Hello and welcome to another video for our Pod to Heal Heals 2020 campaign. And today I'd like to show you a strapping and taping technique that I like to use for plantar heel pain and plantar fasciitis. Now there are two types of tape that you can use for strapping and taping of the feet. The first is Kinesiology Tape, which is the brightly coloured tape that you'll often see athletes wearing. Now, I don't particularly like this for taping heel pain. It's quite stretchy, so it doesn't really give you the same structural support that you really need. I like to use Zinc Oxide tape. You can get it quite cheaply at local chemists and pharmacists. Really easy to use, really quite sticky, so it stays in place really well. And it comes in different thicknesses as well. Doesn't make too much difference which thickness you use, it just means you might need to use more strips or less strips. So the way I like to do it is I start off with a thinner bit of the Zinc Oxide tape and I actually attach it around about the base of the fifth toe, around the fifth metatarsal, and I come across and around the heel, pulling quite tightly. You want quite a lot of tension on this, and you come back and come just underneath your big toe joint there, your first metatarsal, where you secure that nicely so it's nice and supported. You should already feel some support. You're not allowing excessive movement of the foot around there. And then I like to switch to the slightly thicker tape just because you need less strips really. And again, what I'm going to do is I will just start around about the same place and bring it all the way around the back of the heel, finishing in the same sort of area again. And this is more just to give you something to stick the rest of the tape onto. Now I have cheated a little bit and I have pre-cut some strips. So what you do is you measure up approximately how much tape you'll need. So for the next bit, we're going to be strapping across the foot. So make sure this tape is well stuck down. And then I like to start kind of around where the heel is meeting the arch area. And I will go from the outside of the foot, pulling quite tightly to the inside. I'll do that a few times so that the heel is pretty much covered. And then we'll do a couple around the forefoot and just going the other way. So from the side from your big toe across, and one more there. And then what you want to do is secure around those so those bits don't actually come away when you're walking in your socks or your shoes. So again, I'll just secure it with a big bit of tape. And around there. So what you should find is that your heel and your arch and it just coming into the forefoot area feels quite nice and secure, and when you stand on it you shouldn't feel too much expansion of the foot. It should be held quite nicely and in place. You can leave these on for a couple of days at a time. If you're suffering with an acute bout of plantar heel pain, plantar fasciitis, we recommend doing this for kind of up to 6 weeks, basically, strapping it, see if that eases your symptoms. Any questions, any comments, feel free to pop them below this video or message me directly. And if you want any strapping advice, get in touch.